Recently, an urgent need to reuse the existing health data has emerged. In this regard, Fair for Health project aims to provide principles and guidelines to improve the findability, accessibility, interoperability, and reusability of health data. FAIRification process will enable the reuse and share of clinical, biomedical, and research data, and promote the development of value-based healthcare services and products to improve personalized care and preventive medicine. In parallel, the digital transformation of healthcare aims to empower citizens, to generate added value for innovative companies, and to provide wider suggestions to stakeholders on the path towards the optimal use of scientific data. Nevertheless, this verification process brings novel challenges, such as personal and sensitive data. And currently, there's a lack of knowledge among the use of fair data on health. Herein, we create 3 user scenarios to provide evidence-based representations on the impact of FAIR strategy on health outcomes, innovation, research, and on boosting citizen science. The first user scenario is about H-Data Care, a health startup.
This user scenario is about H-Data Care, a health startup founded 4 years ago by 2 colleagues in Porto, Portugal. With 20 workers and growing, it recently got a project funded in an international application. Since faculty, the ambition of these colleagues has been to reuse the great amount of real data generated throughout these years. To realize their vision, they developed the digital tool PAIRcare, mainly directed to healthcare professionals, caregivers, and patients. Clinical databases consist in large amount of raw data, which after patient consent is collected, anonymized, and submitted to the verification process. PAIRcare uses data or metadata from health verified databases from patients, citizens, and health units. Through artificial intelligence and machine learning, PAIRcare integrates health data into a digital tool that allows the analysis of complex clinical data. Thus, taking into account patient signs and symptoms, PAIRcare proposed to the healthcare professionals differential diagnosis, prognosis, theoretical foundations, treatment guidelines, and also costs, aiming to support an integrative and personalized healthcare as well as improve the quality and efficacy of healthcare services. Currently, H-Data Care startup is developing new services for patients and caregivers to improve self-management of disease and to empower citizens through enhanced health literacy.
The second user scenario aims to promote citizen science.
Maria Silva is 67 years old and is a waitress in a famous restaurant in Faro, Portugal. She lives with her husband, children, and her elderly mother. At the age of 5, Maria was diagnosed with diabetes mellitus type 1. Recently, her mother moved into her house due to an advanced stage chronic disease, and since then, Maria is having problems controlling her glucose levels. H-Data Care startup developed Smart Glue, an health device which is a smartwatch to help patients and caregivers to manage disease. Encouraged by her family physician, Maria started to use the smartwatch. This device works as a sensor when applied on the wrist that contains a thin and painless needle inserted under the skin that measures glucose levels in a regular way. Smart Glue shows and registers glucose levels at the smartwatch screen, allowing Maria to follow the trends of her glucose levels at each time and improving her conscience on the impact of actions on her health. Additionally, Smart Glue indicates the glucose levels of people in the surroundings, 30 kilometers by default. So, Maria can compare her glucose levels and disease control with other patients anonymously as a way to encourage her to keep diabetes under control in a daily routine. After patient consent, glucose levels and other health data is anonymized, processed, and stored at an interoperable personal health record system whose access is controlled by patients. Caregivers and healthcare professionals have real-time management of Maria health status, allowing a home-based monitor of the disease. Nowadays, Maria is feeling more motivated to control glucose levels and tracks her data in a daily routine, comparing her disease control with her neighbors.
This user scenario represents the interoperability among different systems, such as an hospital and a research center.
The Health Data Research Center is based in Porto since 1988. In 2008, it was ranked as exceptional by the European Science Foundation evaluation and gathers a team of 127 integrated researchers from bioinformatics, chemistry, and biological sciences backgrounds. This research center uses raw data from health unit databases as hospitals, health research, and citizens or patients' clinical and biomedical data, which, after consent, is collected and stored in an interoperable personal health record system. Health data, or metadata, is submitted to a FAIRification process to transform raw data into FAIR data. The latter is findable, accessible, and readable by humans, machines, and computers. Health units, as hospitals, and research centers may exchange clinical data between them, taking the advantage of interoperability principle of FAIR. Additionally, researchers from Health Data Research Center may share and reuse data and provide further information to be integrated in the FAIRification process during their research. Health companies and startups, as H-Data Care, may use FAIR health data to develop solutions and medical devices to improve quality of healthcare services and promote personalized care.
This approach that we have seen enables the design of representative user scenarios with related needs to different segments of populations: a startup, citizens, health unit like hospitals, and research center. These user scenarios explore specific aspects of healthcare services, products, or needs, and ultimately generate innovative services based on FAIR datasets. In this way, we can identify technical hurdles and overcome challenges that we'll overcome with FAIRification process. But foremost, we here show the impact of using FAIR data on health research, not only to researchers and stakeholders representing academia, but also citizens.